In today's video, we're going to talk about nursing judgment, what it means, why it matters, and most importantly, why caregivers can't make those kinds of decisions under delegation. Even though caregivers play an essential role in patient care, there are specific clinical decisions that only a registered nurse is allowed to make. Let's break it down a little simpler. Nursing judgment is when a licensed nurse uses training and experience to make decisions about a client's care. It includes looking at how a client is feeling or changing, deciding if those changes are serious, knowing when to call a doctor or send someone to the hospital, and figuring out the safest plan of care based on what's happening. These decisions involve critical thinking and clinical assessment, skills that take years of education and practice to develop. That's why it's written in the Revised Code of Washington that tasks requiring nursing judgment cannot be delegated. Now let's talk about why caregivers shouldn't and legally can't make these types of decisions. Caregivers, including CNAs and home care aides, are trained in hands-on skills, like assisting with dressing, feeding, medication administration, and more, but they don't have the clinical training to assess symptoms or decide what treatment is needed. That's why the nurse delegator is responsible for teaching the caregiver what to do, creating a step-by-step plan, and being available when problems come up. If a caregiver makes a medical decision without a nurse, it can put the client at serious risk, as well as your own certification or job. As a caregiver, you should be given access to the physical forms provided by the nurse delegator for reference when performing any delegated tasks. These forms are required by DSHS and they are called NTI, or Nursing Task Instructions. Let's talk about a situation that could happen and explain why only a nurse can make the decision. Let's say a pressure sore develops. If a client develops a pressure sore on their skin, only the nurse can determine what stage it is, how to treat it, and what supplies are needed. You can help carry out the care under the nurse's instruction, but the nurse needs to make the decision on what care is needed, even if that just looks like escalating the concern to the primary care provider and getting a wound consult. Even though you can't make nursing decisions, as a caregiver, you still play a critical role because you help the nurse by being their eyes and ears. Nurses rely on you to observe carefully, to notice if a client is acting differently, eating less, sleeping more, if they're falling or seem confused. If you notice this, report it right away. If something seems off, or even if you're not sure, tell the nurse immediately. Never try to just fix a medical issue on your own, even if you think you've seen it before. It could be something very different this time. One helpful way to understand the scope of practice is to picture a ladder of roles within the healthcare system, with each step representing different levels of responsibility and training. A general example in simple terms is that a caregiver is to a nurse what a nurse is to a doctor. Each role is essential to the team, but each comes with different responsibilities, training, and legal limits. Caregivers provide daily support, assist with personal care, and carry out delegated tasks, but they do not assess conditions or make nursing judgments. That is the nurse's role. In a similar way, nurses perform assessments, make nursing judgments, and delegate care tasks, but we don't diagnose or prescribe. This falls under the scope of a licensed medical provider like a physician or a nurse practitioner. So just like a nurse shouldn't step into the doctor's role, caregivers should not step into the nurse's role. Staying within your scope protects the client and keeps everyone legally compliant and safe. Just a quick recap, nursing judgment is about using clinical knowledge to make care decisions. That is something that only a licensed nurse is allowed and trained to do. When each member of the care team understands their responsibilities and communicates clearly, care is not only safer, it's more effective. This teamwork helps keep clients safe and ensures you're working within your legal role. If you ever have a question about what's allowed, or if you see something that concerns you, reach out to your nurse delegator. We are here to help, and it's always better to ask than to guess. Thank you so much for watching, and thank you for everything that you do to support our clients in your care. The link to the RCW that I referenced in the video can be found in this video description.